Maina, go ahead. You can kick it off.
Namaskar, Samasthanku. Good afternoon, and welcome to the OSA Health and Wellness Academic Series, Cancer Awareness Section 1. And thank you all for joining. And regarding our life, this health and wellness awareness is for our life, right? And so the importance of life, I was thinking, and I remembered a beautiful quote by Pope Francis. Rivers do not drink their own water. Trees do not eat their own fruit. The sun does not shine on itself. And flowers do not spread their fragrance for themselves. The law of nature is living is for others. We are all born to help each other. No matter how difficult it is, we have to stand for each other. Life is good when you are happy, but much better when others are happy because of your action. Saying this, I will proceed with the next event, which is the start of the event with a beautiful prayer by none other than our senior and founder member, Dr. Basant Mahapatra. Basant Bhai, please come.
Namaskar, everyone. Thank you, Devasis. Like he mentioned, we all need good life. But to have a good life, we must have good health, good sense, which are two important blessings for us. And for the blessings, not only we need our own action by karma, also we need blessings of God. So all our actions and programs should begin with the auspicious prayer for well-being of all. Let's start the prayer. Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pasyantu, Ma Kaschid Dukhavag Bhavet. Om Santi, Santi, Santi. May all be happy, all be free of diseases. May all see goodness and auspiciousness in everything. May none be unhappy or distressed. Om, peace, peace, peace. Before I conclude, I like to mention one stanza which is very appropriate for the occasion we are in. And it is none, it's by God's own words. It's from Bhagavad Gita, chapter 6, stanza 17. Yukta haro viharasya, yukta chestasya karmasu, yukta sopna vabodhasya, yoga bhavati dukha. That means moderation in food, moderation in recreation, moderation in exercise, in work, in sleep, and in wakefulness will remove all the sorrows, will make us healthy and happy. It's by God himself. He's saying, Arjuna. Thanks all. God bless you.
She's going to back to you. Maybe Shankar, which connection problem. Well, Lena, this was the point where we wanted to request you to say a few words to kick off the program.
Thank you. नमस्कार समस्तଙ୍କୁ बहुत बहुत नमस्कार ଆଉ ଆପଣ ମାନଙ୍କୁ ଏଠି ଦେଖି ମୁଁ ବହୁତ ଖୁସିରେ ହୋଉଛି ଆଉ ମତେ ସୁଯୋଗ ଦେଇଥିବାରୁ ଆପଣ ମାନଙ୍କୁ ବହୁତ ବହୁତ ଧନ୍ୟବାଦ before I say anything actually Devasis Babu said a very nice sentence that we all need to remember that we need to stand for each other. That's the key thing we all are here for. And ame samaste bhi, like, we should thank this organization for keeping us all connected and giving us opportunity to stand for each other. And that's the important thing. And by amar Basant bhai tike au tike extend kari कहले बहुत सुंदर रे कहले जे प्रथम जिंस होची हेल्थ एंड हेल्थ इज वेल्थ एंड केमिति सब जिंस मॉडरेशन रे रखिले जे खुशी रहिले त हम अन्य को सपोर्ट दे परिबा. How do we give support if we are not healthy and mentally and physically fit? So with बेसी समय आधार नेबिनी while saying this, I again would like to thank this health and wellness group of OSA who's doing really great work. Not खाली आम लोक माने आमर मेंबर मानन को खाली आपण माने बहुत सुंदर सेमिनार आनी की इन्फॉर्मेशन प्रोवाइड करछुंदी आ अलगा जिंस रे भी बहुत हेल्प करछुंदी. On top of that, you know, आपण मानकर भलिया बिजी प्रोफेशनल्स समय काढी की and you are giving us time for the community. That's a very inspiring thing. And I myself get inspired with your timing, you know, the profession like you all are in, you know, आम माननको जेतले भाबुची कि in my low time I'm thinking hey कितने समय देबी आदरे, you know, just lot of time, but I think about you all and that inspires me. So I personally, from the bottom of my heart, thank you everyone for, you know, doing this great work and, you know, inspiring us in a great way. Thank you. Namaskar. आपनको अधिक समय नेबिनी. You can continue.
Thank you, Miss Lena Mishra, and that's a wonderful quote for all of us. Thank you so much for the wonderful work you do. So now I would like to say that, you know, as you know, we also have a face-to-face workshop tomorrow, OSA Health and Wellness and OSA New York, New Jersey chapter conducting tomorrow a hands-on breast self-examination with the breast self-examination kit. And if anybody has not enrolled locally, please join. It is a wonderful and first time ever happening in OSA. And we plan to also take it to the convention if possible. And I would like to invite Mr. Nagesh Rajnala, who is also a member of OSA Health and Wellness and ex-president of New York, New Jersey chapter, to speak few words on that.
Thank you, Vana. I speak for myself and Nido as well. Nido is the current president for our chapter. He's on here as well. You know, this was something that has come out of a deep need from our members. बहुत लोग हमको phone करके जोड़े after this incident happened where we lost one of our dear members, that we want to know more. We want to know how we can potentially prevent, avoid, take care of ourselves and so on. So with that, Nido demonstrated fantastic leadership in terms of setting up this session, which is a face-to-face in-person session, and with some training involved. And thanks to the Health and Wellness Group, Dr. Sangeeta traveled from Michigan. Dr. Sushmita is in Connecticut, and Dr. Kanuri is here locally in New Jersey. So we look forward to seeing that tomorrow. So thanks to all of you for the leadership and doing something which is really life-saving.
Yeah. Thank you, Nagesh. Can you hear me?
Yes.
Can you hear me?
How many? Go ahead.
Yeah. Thank you, Nagesh. And I would like to give kudos to our Nilo Sundar Jana, our current New York, New Jersey chapter president. Nilo, do you have to say something? And thanks for your hard work also, Mr. Jana. Are you there?
Yes, Vaina. And Samastanku Namaskar. Vaina, mote ye nahi. So it's thanks to you, Health and Wellness Group, Samastanku. Kaina ame just got a request kalu apan mane seta ko sange address kale seta. We are thankful from the entire EC and Women's Forum. We reached out come time re ସମସ୍ତେ ଆସିକି ଆପଣ କହିଲେ ଚାଲ ସେଇଟା ଯେହେତୁ ଆମେ ଆପଣଙ୍କ ଆମ ଚ୍ୟାପ୍ଟର ଲେଭେଲରେ କରୁଛନ୍ତି ଆପଣ ସେଇଟା କହିଲେ କାହିଁକି ସେଇଟାକୁ ଆମେ ଏକ୍ସଟେଣ୍ଡ ନ କରିବା ନ୍ୟାସନାଲ ଲେଭେଲରେ ସେଟା ବି ଗୋଟେ ବହୁତ ଭଲ କଲେ ତେଣୁ ଭାଇନା ଏଟା ଇଟ୍ସ ଅଲୱେଜ ଏ ଟିମ୍ ୱାର୍କ ତେଣୁ ହେଲ୍ଥ ଆଣ୍ଡ ୱେଲନେସ୍ ଗ୍ରୁପ ଜିନ୍ଦାବାଦ.
Thank you, Nilo Babu, and keep on doing the good work. So now let's start with the event. So I will welcome Dr. Bikram Paul. He's an esteemed physician, and as you can see, he's the emeritus professor of surgery, adjunct professor of surgery, and I would like, we are glad to have him here. Bikram bhai, please come in.
Namaskar. Everybody can hear me? Am I audible?
Yeah.
Okay. I want to dedicate my talk to Mrs. Mahapatra, who left for heavenly abode recently with the cancer. And I have my condolences to the family of Dr. Mahapatra and the family. And that has inspired us to start this series. Why we are doing this? Puthivere cancer ro burden ta bahut badi jaichi. Both puruso, stree, pilamanokor samastakor cancer badi chalichi. Global cancer burden you can see that from the slide that 19.96 million people just in 1 year, out of which female breast cancer 2.3 million, which is 11.6%. Lung and bronchus, bronchus is the small tubules inside the lungs. Passages, air passage is bronchus. Together is 2.5 million, which is 12.4%. Colorectal cancer, 1.9 million, 9.6%. Prostate cancer, 1.5 million people, 7.3%. And total cancer death in the world, 9.7 million. Now going to because we are all from the Indian origin, I just wanted to show this, that in India, according to the Ministry of Health, 26 out of 100,000 women suffering from cancer. In the urban areas, 1 of 22 women. And in the rural area, 1 of 62 women. And the 5-year survival is 40 to 62%. And so there is a huge cancer burden also. And we are all from that Indian origin, so we are prone to that. Next slide, please. Now I'll just show in this pie chart that the load of this is 2020 World Health Organization and the International Agency for Cancer Registry. The breast, as I mentioned before, the amount, the number, the lungs, and then the colorectal, and then the prostate. In the right side on the pie chart is the number of deaths. You can see that in the lungs, the number of deaths is almost 18%. Colorectal is 9.4%. And breast is 8.9%. And prostate is 3.8%. Next slide, please. So with this cancer burden in the whole world and the mortality, we are trying to make it more and more aware for our community, ODIA community in the United States and Canada. And this is the US anticipated census. This is by the projection by the CDC, National Cancer Institute, and American Society of Cancer Society. In this pie chart, you can see that the breast in the United States projected is 16%. That is 313,510 people, women and men, will be afflicted with that. Prostate, 299,000, which is 15%. Lung and bronchus, 234,580, which is 12%. And colorectal and colon and rectum cancer is 153,000, which is 8%. Now coming to the mortality projection from this disease, lung and bronchus will be very high still, which will be 20%, I'm sorry. Colon and rectum is 53,000 mortality, which will be 9%. Then the breast cancer is 47,780, which will be 7%. The prostate is not projected yet, but the reason being that in the last 3 years, there has been a lot of confusion about the mortality from prostate cancer, or is it due to COVID or heart disease, infectious diseases, pneumonia, etc. So it's not projected, but it is estimated that it will be about 3 to 3.5%. Next slide, please. This is showing the incidence between male and female. So I have highlighted this in the red. They start with breast. Breast, as usual in the male, it is only small number of people, 2,790. In the female, it is 310,720. Prostate, of course, it is exclusively for the male. So it is 299,000. and lung and bronchus. This is what I want to focus, especially ଆମର ଯୋଉ ନାରୀ ଜାତି ମାନଙ୍କ ପାଇଁ ଦେଖେଇବା ପାଇଁ, that lung and bronchus cancer is very high incidence in females, 118,270, in comparison to slightly less, 116,310. This is when we come to the risk and lifestyle factors that will be described by my subsequent speakers from that. Colon and rectum. It is almost even little male in the higher, 81,540, and in the females, 71,270. So this is the number of cases with the cancer. Next slide, please. Now, breaking down to in 2023, this is the statistics. Data has come out from the National Cancer Institute and the CDC that the number of cases or the 4 major cancers by sex and age group. And I'll just keep this all. This is just the total number showing that here it is. This is the age group between 50 to 65 is the highest number of cases, disease. Similarly, female also same, highest number between this age group. Now, next to that, starting with the colorectal cancer. The reason I have highlighted this red square here to give more impact on the minds of people, why we should be more vigilant about the screening methods when we come to that next subsequent lecture by the subsequent speakers. In the males, all ages 81,800, female 71,160. But look at this, below the younger people, below 50, we are seeing young age 20 to 25, 30-year-old now with colorectal cancers, especially rectal cancers. And this is really scary, but we have to be more discussing about that. In the males, it is 10,500, females 8,900. And again, going to the age group, between the age of 50 to 65, between 61,300 to 39,300 is in the males, and 62,100 to 28,000 in the females. This is the highest group, age group. And again, as we advance with older age, it continues. 42,000 in the males and 42,700 in the females. Now I go to the breast cancer. This is exclusively for the female because in the males, it is a small number, 2,900 as I showed, 297,790. This is just in the US. And below, under 50 years is 48,700. So we are seeing female patients with breast cancer as young age, 25 to 30 years old. And the highest number again at between 50 to 65 age, 290, 249 to 147,000. And as it advances, it is 150,000. Then comes
Can
the
you go
prostate.
to the next test, Bikram bhai?
I'm sorry, what?
No, the next slide. Yeah, prostate.
Yeah, prostate 280,000. And, as usual, in the age group of between 50 to 65 is the highest. And it continues to this. Next slide, please. Yeah, I see the next slide, yes. This is the US mortality, the death rate from the cancer. Lung and bronchus is 65,700 in the males, but in the females, it is interesting that even their incidence is higher, the mortality is 59,208 less. That would subsequently it will be discussed. Colon and rectum, they are almost equal, but more in the males, 28,000, in the females, 24,000. And in the prostate, breast, it's expected because the number is less incidence in the males, 530, and in the female, 42,250. And the prostate, of course, in the males only 35,250. And that incidence is lower because prostate cancer is a slow growing cancer and people live for a long, long time. That's why the mortality is less. Now summarizing, US in 2023, 1.9 million new cases were detected, reported, out of which 609,800 deaths. But fortunately, over the last 30 years, in the United States, year by year, there is a 33% decrease in the mortality because of the early detections, surveillance, management strategy, and new drugs and the surgical management. And this is from the NIH, CDC, and American Cancer Society data. This is just to summarizing that breast 297,000 and deaths 44,000, prostate 288,000 and death 34,700, lung and bronchi 238,000 and death 127,000, colon and rectum 153,000, and mortality death is 22,500. Next slide, please. This is my last slide. In the US 5-year survival rate, in the breast, overall 90.8% 5-year survival. But if it is diagnosed early by stage 1, the survival rate is as high as 98%. And as the staging of the advanced stage continues, the survival rate decreases. Lungs, men 23% and women 33%. You can see that in spite of all the modern treatment and management and everything, still the mortality survival rate is not that high, 5-year survival. Women is better, 33%. Colorectal cancer, 80% overall. If stage 1, one can diagnose, it is almost 98%. And the prostate, 97% is the survival rate. So the reason I brought out these statistics to show the incidence, ଆମର ସବୁ ଓଡ଼ିଆ ଲୋକ ଯେ ପୁରୁଷ ମହିଳା ସମସ୍ତଙ୍କୁ ଏଇ ଚେତାବନୀ ଦେବା ପାଇଁ ଯେ କ୍ୟାନ୍ସର ରୋଗଟା ବହୁତ କର୍କଟ ରୋଗ ବହୁତ ବଢ଼ି ଚାଲିଛି ଆଉ ଅନ୍ୟାନ୍ୟ ଛୋଟ ଛୋଟ ବୟସରେ ମଧ୍ୟ ହେଉଛି ତେଣୁ ସମସ୍ତେ ଯେମିତି ଏଥିପାଇଁ ଧ୍ୟାନ ଦେବେ ମୁଁ ବର୍ତ୍ତମାନ ବନ୍ଦ କଲି ନମସ୍କାର ଥ୍ୟାଙ୍କ ୟୁ ଭେରି ମଚ୍
Thank you, Bikram Bhai. That was very detailed and wonderful. And I would like to welcome Dr. Sanjay Agarwal, our young and dynamic pulmonary and critical care specialist in California. Come in, brother.
Please unmute.
Sanjay bhai, you should be able to unmute.
All right. Good morning, everybody from the West Coast, and to the East Coast people, good afternoon. Welcome to the presentation and thank you for the opportunity. So thank you, Bikram Bhai, for talking about the statistics of cancer. And it's sad that we are still losing a lot of lives. I want to make some initial comments, and that would be cancer does affect everyone, whether it is young or old, or rich or poor, men, women, children. And it is a huge burden on patients, families, and societies, whether it's humanity, whether it is cost-wise, or whether it is emotional downfall and everything. Cancer is the second leading cause of death globally. So 1 in every 6 deaths is because of cancer. Last year, we had about 10 million deaths annually. 30 to 50% of cancers are preventable by healthy lifestyle choices, and I'm going to make some slides in a few minutes. Greater than 70% of deaths from cancer occur in low and middle-income countries. And it's maybe because of infections or their limited resources for early detection or treatment, etc. And there's no sure way to prevent cancer, but you can reduce your cancer risk by making some healthy choices, by eating right, staying active, not smoking, losing weight, etc. Lung, prostate, colorectal, and stomach and liver cancers are common cancers in men. and breast, colorectal, lung, cervical, thyroid cancers are common in women. Next slide, Rakesh bhai. Next slide, please. So cause of cancer, most cancers is not well understood, even though we may think science has made a lot of progress over the last 30 years. And as Bikram bhai showed that the death has decreased, but even then, we still don't know most of the cancers as to why they happen and whatnot. And why one person develops cancers and other doesn't. It's a complex problem. There are numerous risk factors we know now, some which are scientifically proven, some which are not, some which can be modified, like tobacco and obesity, and some which cannot be modified, like mutations or genetic linkage. Risk factors may act simultaneously or in sequence to initiate or to promote cancer growth. And some risk factors decrease the risk of cancers, and they are called usually protective risk factors. In general, people have talked about vitamin A and vitamin D. Some are proven, some are not. And tobacco use is the most important risk factor for cancer, and is responsible for approximately 25% of cancer deaths all over the world, for many different types of cancers. Next slide, please. So this slide is the crux of the matter today. What are the risk factors for cancer? Most studied, known, or suspected risk factors. These are scientifically proven. These have been vetted over the last 20 years. And I want to list them up here with the help of diagrams so it can sit in mind. Age, alcohol, tobacco, diet, obesity, radiation, infectious agents like human papillomavirus, cancer-causing substances like phenol and formaldehyde, environmental pollutions, chronic inflammations, hormones, especially female hormones, immunosuppression. Immune system is involved in the body to take care of these cancer cells, or sunlight, the gamma radiation causing skin cancer. So once again, going over the slides, age, alcohol, tobacco, diet, obesity, radiation, infectious agents, cancer-causing substances, chemicals, chronic inflammation, hormones, immunosuppression, and sunlight. These are the risk factors which are vetted and scientifically proven. Next slide, please. One more button. Some risk factors can be avoided and some cannot, as I mentioned before. Limiting exposure to avoidable risk factors may lower the risk of certain cancers. And that's what I meant by saying 30 to 50% of cancers can be protected and prevented or delayed. Next slide, please. So what are the common misconceptions? A lot of these things we hear, which are deep-based bias on our previous knowledge, most of them are not proven to be scientifically true. For example, is cancer a death sentence? Not quite. So there are a lot of people are surviving cancer. As Dr. Paul just now mentioned, almost 80% or 97% of prostate cancer can be protected. Will eating sugar make cancer worse? Not quite. Even though cancer cells do require sugars to grow, but sugar eating does not make it worse. Is cancer contagious? No, it's not. If it is maybe a virus disease like HIV, which leads to further other cancers, or human papillomavirus is a different issue. But you don't want to isolate people with breast cancer or colon cancer or something like that. It's not contagious. Does attitude make it worse or better? Not quite. I mean, even if you have positive attitude, the cancer will not just go away. Will cancer get worse if exposed to air? Not quite. That also is the wrong notion. What about power lines and cell phones? They also don't cause cancer, has been proven, even though it's controversial. If one member in the family has cancer, will you be risk-free? Not quite. So that is also depends on your genetic lineage, and genetic analysis will help you understand if you are recessive or able to get the cancer. What about antiperspirants or deodorants? They also have not been shown to cause any breast cancer. Next slide, please. So I listed out those 8 common risk factors in the couple of slides ago. And these slides are, I'm going to talk about each of these topics slightly more. Age, as we know, that previously the notion was as younger people don't get cancer, but yeah, they do get cancer, maybe less. So less than 20 years, about 25 people in 100,000 people had cancer. As we grow older, the risk of cancer increases, as you can see from the slide. What about obesity? Obesity has been shown to have increased cancer risk for breast, colon, GI tract, endometrium, esophagus, kidney, pancreas, and gallbladder. Several of these cancers can be reduced if you reduce your BMI, body mass index, which is called. Next slide, please. Alcohol causes, go back one. Alcohol causes increased risk factors. One more slide back, please, Nagesh. Alcohol causes increased risk factors for mouth, throat, GI tract, larynx, liver, or breast. Awareness is lacking, but we need to change that. We need to educate people that alcohol, even 1 ounce of alcohol, is not good enough. The suspected thought is that red wine does cause protection. It has got some anti-cancer properties, but there is no evidence that wine reduces cancer risk, scientifically proven. Tobacco is a leading cause of lung cancer, colon cancer, and bladder cancer, and other cancers, as also increased risk of death cancer. As I mentioned, almost 25% of death in the world can be protected if we make the world tobacco-free. It's equally dangerous for both smokers as well as secondhand smokers. It has more than 7,000 chemicals, and 70 of them are known to cause cancers. And it's a single greatest avoidable risk factor. More than 8 million people die of cancer each year. And nearly 80% of these 1.1 billion cancer smokers live in the low and middle income countries who don't even know if smoking is bad for them. Next slide, please. What about diet? So we have proven beyond doubt that the healthy eating or the diet rich in vegetables and fruits are better. You want to avoid processed meat, red meat, artificial sweeteners, antioxidants, alcohol, acrylamide, and increase cruciferous vegetables in your diet. Fluoride has been shown to decrease infections in the gums and teeth, but not so much in preventing cancer. Hormones, the several hormones in the body, they increase, they lead to cancers, especially the oral contraceptives and cancer risk is known, as well as for ovarian cancer and breast cancer. Next slide, please. Sunlight, it has the UVA and B radiation. The UV radiation can cause early aging of skin and damage of the skin. It can cause cancer as well. Sun rays are strongest between 10 a.m. to 4 p.m. And we should use light clothing, windshields, windows, etc. It can also get reflected by sand, water, snow, ice, and pavement. So we need to be careful around sunlight radiation, UVA radiation. Same token, the radiation from other wavelengths, they can also damage DNA, especially the X-ray radiation, which we usually use in medicine. They also can cause cancer, but fortunately, the dosage has been decreased substantially in the recent years because of the awareness. Next slide, please. Immunosuppression, if your immune system in the body is suppressed, its ability to fight off the cancer cells goes away. And we want to make sure that your immune system is good. Similarly, infectious disease, because of many viruses, bacteria, parasites, etc., they do cause cancers. And human papillomavirus or schistosomiasis are known causes. Next slide, please. Some cancer-causing substances, they disrupt the DNA and lead to cancers. And the list is endless and it's ever increasing. We need to be careful or cognizant of what the FDA and other bodies are talking about cancer generating substances. And we need to be careful about what we're eating as well. Chronic inflammation, if you're obese, lead to fatty liver disease, lead to liver cancer, or ulcerative colitis or Crohn's disease. These are inflammation of the colon. They can lead to colon cancer as well. Next slide, please. So what are the things which you can do? The 8 commandments to avoid cancer. Eat a healthy diet, avoid processed meat, eat more vegetables, cruciferous vegetables. Don't smoke or use smokeless tobacco in any form, chewing or even cigars. Even vaping has been associated with cancer as well. Exercise regularly, maintain a healthy weight, should be within the BMI recommended as per the American Diabetic Association. You should limit alcohol. Of course, 0 is the best. For some social alcohol, maybe a glass of wine in a month, maybe it's okay, I guess, but 0 is the best. Limit red and processed meat. Protect your skin from the sun and avoid tanning beds. Protect yourself from sexually transmitted infections. And most importantly, be aware of the screening tests available for colon, lung, breast, and prostate, which is the main topic today. And with this, I thank you and pass on to the next speaker.
Thank you so much, Sanjay. That was a wonderful presentation. And then we would like to invite our beautiful member and a senior physician and a founder member of the OSA Health and Wellness, Dr. Sangeeta Pradhan, for the next presentation.
Namaskar, Sangeeta Pradhan from Michigan. Samaste details tike ame dekhile about risk factors, tapare statistics. Now we will go to the details. ଆଉ ଯଦି କିଛି questions ଅଛି, please chat box ରେ type କରିବେ. ଆମେ presentation ପରେ we will address everybody's questions. Why are we talking about breast cancer? It's very common, more common than we know, and lately we have been seeing more and more, especially also in our communities. 1 in 8 women has a risk of developing breast cancer. Why are we worried about catching it and the screening? Because jodi early stage re ame eta catch kariba screening re, it is completely curable, and jette delay habo, it will affect our quality and quantity of life, and suffering will be less if we catch it early. So how do we do that? So it's a team. Apan mane as a patient, as by self-exam, masuku thare karibe around the same time of your cycle, and very easily it can be done in the shower. Kintu annual exam, nischay barsuku thare apanko doctor manku pakku jibe and go for an annual physical exam. Kebe kariba eta sarla pore next kono. Once you turn 40, you should have a screening mammogram till the age of 70. Details we'll discuss later. It can be done sooner in certain cases if you have more risk factors. And when do you stop? When a patient's life expectancy is less than 5 years or they have a poor quality of life. Next slide. So risk factor kona? Deeprakar risk factor, one that we can modify, that Dr. Sanjay just mentioned. And there are also non-modifiable risk factor, which we cannot change, like how, to what family we are born, what is our genetics, and what kind of breast tissue we have. And if we already have a previous history of breast cancer, obviously we're at higher risk. Next slide. So modifiable risk factors, same like we just heard from our previous speaker. So we'll go on to the next one. Annual physical exam. So just we should be careful, but at the same time, we don't have to lose our sleep over everything, because all lumps are not necessarily cancer. Kemti janiba tahale? So one is by the looks of it, then by touch, which is called palpation. Or jadi we see any discharges or any changes in the skin. So skin changes mane, the skin of breast, which is usually smooth, if you see any unusual redness, or if it looks like an orange peel, or jo kamala choppa bhaliya jodi dekha jibo with dimpling and all, that is not a good sign. So again, nipple discharge is not always cancer, but the risk, you should be more careful if it is spontaneous or if it doesn't go away. Bloody discharge from the nipple is definitely more of a concern. Next slide. Acha, eti dita hame lump dekhuche, and we can be panicked from both. But at the same time, if you see the one on the left, A, is actually an infection. It could be just an abscess or fluid collection, and just with drainage, it can get better. However, B slide, as I was explaining, looks like jo kamala choppa mu kohutili, semtia dekha jauchi. So at that time, it's very, very important, obviously, for both conditions to see your doctor and go ahead with further testing. Next slide. Prevention, ame sabu common preventive factors kotha hele. So I will just go to the ones that are pertinent with breastfeeding. The common one, obviously, diet, exercise goes with everything. Smoking, alcohol intake, all that. But in addition, breastfeeding is protective for breast cancer. Pregnancy is protective, but late pregnancy can be a risk factor. And as much as possible, we should avoid hormones with estrogen and progesterone, especially postmenopausal, after menopause. So that would definitely improve or reduce the chances of getting a breast cancer. Next slide. So eta sorigala exam part and kono ame dekhuche, but now we go to imaging. So number 1 is mammogram, wherever possible. Next one is the 3D mammogram, which is tomosynthesis. And then if your doctor recommends, you may need screening ultrasound or MRI, which is more detailed. Next slide. We should never forget that women are not immune to other cancers, as we listened from our previous speakers. We're not just worried about breast or cervical. We should also be careful about lung, colon, and other cancers and follow the appropriate screening. So we have to follow the appropriate guidelines, which is related to our age and condition. Next slide. So there's a funny slide on the left side, as you can see, a woman with breast cancer who's lost all her hair, running all her errands, and taking care of the family and everything. And at the same time, a man who's down with the flu in his bed. Hopefully, after this presentation, you all don't feel more confused. That's why we are welcoming questions. And that's it. Thank you.
Thank you, Dr. Sangeeta Pradhan, for a wonderful presentation. And this will be our last presentation before we go for questions and answers. I would like to invite Dr. Subhashish Mishra, who is surgical oncology and is a program director of surgery residency program in Tampa, Florida. Welcome, Subhashish.
Namaskar, Bhai Boni Mananku. Thank you for the opportunity. I just wanted to start by recognizing my mentor, another famous Odia surgeon, Dr. Prasanta Raj. He has been a great mentor and a wonderful human being. So whatever I know, I've learned from him. With that, I think amara gote bhalo sequence chalchi ame incidence upare kotha halu, the 4 common cancers ame kotha halu. There are other cancers jota ki ame subsequent series ame address karibu, but these are the 4 common cancers. More slide abhi focus karibu on colorectal cancer. Overall, it is the 3rd most common cancer, 2nd leading cause of cancer death in the United States. Lifetime risk, not much of difference between men and women. As it is, they are worried about breast cancer, ovarian cancer, endometrial cancer. So generally, colon cancer screening is equally important. Speakers the incidence is very similar. So say that please man rakhibe. Next slide. So dated slide achi, but around 150,000 to 160,000 new cancer cases are diagnosed, and majority 3/4, almost 3/4 asibo in the colon and 1/4 in the rectum. Rectum uchi joda ki moladwara pakhire joda ase. Anal canal or rectum seta ame ko overall taku ame colon cancer kochu. Majority jemti Bikram sir dekheithile hochi 50 to 75 years of age re cancer ve, kintu US रे especially आमे आजिकली देखुचु जे बहुत young age रे भी लोकों को कैंसर होची, सेति पई स्क्रीनिंग गाइडलाइंस लास्ट 2-3 वर्ष भितरे चेंज करला. नेक्स्ट स्लाइड प्लीज. जते जल्दी जो भी कैंसर आपण धरि परिबे ताले तार कंट्रोल और क्योर चांस सेते बढ़िबो. तो आमे जोटा को आमे देखुचे जदी आमे अर्ली स्टेज रे कैंसर टा को डायग्नोस करलु, कोलोन कैंसर इज वन ऑफ द कैंसर्स जोटा कि आमे पूरा प्री कैंसर स्टेज रे स्क्रीनिंग कले धरि परिबा आ कंप्लीटली प्रिवेंट कर परिबा. मानि नियंतु जदी आमे कोलोनोस्कोपी करलु कि आउ को टेस्ट जानि परलु कैंसर अछि अर्ली स्टेज अछि ताले सेई लोक बहुत वर्ष बंचि परिबे. 5 वर्ष सर्वाइवल आमे जोटा कि देखु कैंसर दुनिया रे सेटा बंचि परिबे. जेमति कैंसर माडी माडी चलिबो तांकर सर्वाइवल टा कमी चलिबो. सेति पई स्क्रीनिंग ए सब कैंसर्स पई बहुत इंपोर्टेंट. नेक्स्ट स्लाइड प्लीज. कहना सबुठु इंपोर्टेंट सिम्पटम आमे भाबु जे धियोटा कोनटी असुविधा हला दरज हला ताले हम जे देखैबु कोलोन कैंसर अर्ली कोलोन कैंसर किछि भी सिम्पटम आपण देखिबेनी. सेति पई स्क्रीनिंग होची इंपोर्टेंट. बॉयस हेले हमर स्क्रीनिंग गाइडलाइंस अछि बिटवीन 45 टू 75 इयर्स ऑफ एज. पुरुष स्त्री दुहे जक जाई कि स्क्रीनिंग करिया दरकार. कहना यार सिम्पटम किछि न थाय स्पेशली अर्ली स्टेज रे. आ हमर गोल होची जे हमें केमिति अर्ली स्टेज को धरिबा ताले we can prevent up to 25 to 50% of cancer death for colon cancer. Next slide, please. Teno screening recommendations kon kochi preferred hochi either apna colonoscopy karibe. Start at 45 years of age, both men and women, and up to 75 years. Seta बहुत important janiya pai. Au ideally colonoscopy karibe. Jodi colonoscopy normal hela tale puni 10 वर्ष pare apanku recommendation मिलिबा आउथरे करिया pai. बहुत जन कोलोनोस्कोपी करि पारंतनी फॉर वेरियस रीजंस कि दे डोंट वांट टू गो थ्रू दैट ताहले तार अदर अल्टरनेट जोटा कि रेकमेंडेड नेशनल गाइडलाइंस अछि जोटा कि हमें को फिकल इम्यूनोकेमिकल टेस्टिंग बेसिकली एटा होची गोटे घरे आपण स्टूल सैंपल लगे कि गोटे कार्ड रे पठै परिबे गोटे स्लाइड अछि मु देखेबी ताहले सेटा किंतु जदि नेगेटिव हला एटा को प्रत्येक वर्ष करिया पड़िबो किंतु इट्स अ वेरी इजी वे हमरो गोल होची जे इवन दो कोलोनोस्कोपी समस्त आइडियली प्रेफर करंती द गोल इज टू गेट स्क्रीन्ड जो भी मेथड रो कोलोनोस्कोपी किंबा फिट there are other methods जोटा कि मैं मेंशन कराइची but I won't go into that much detail कोलोगार्ड आपण टीवी रे देखुथबे advertisement but that is not in the preferred list of cancer screening next slide please जदि आपणकर फैमिली मेंबर काको कोलोन कैंसर हेतिबो तेणु आमे रेकमेंडेशन करिवु जे 10 वर्ष तांकर जेबे हेतिला तार 10 वर्ष आगुर आपण स्क्रीनिंग आरंभ करिवे और प्लीज मन रखंतु 45 to 75 इयर्स बेस्ट स्क्रीनिंग होची जोटा कि आपण करि परिबे नेक्स्ट स्लाइड जदि कोलोनोस्कोपी करले कोलोनोस्कोपी होची आमे जोटा कहू डायग्नोस्टिक एंड थेराप्यूटिक ता माने आमे सेही गोटे समय रे आमे डायग्नोसिस कर परिबु आ जदि देखिलु गोटे पॉलिप अछि आमे ताकू बायोप्सी करी बाहर कर दे परिबु सेति पई दैट इज नोन एज अ वन स्टेप स्क्रीनिंग रिकमेंडेशन तार से होची एडवांटेज आ टू स्टेप होची जोटा कि आमे स्टूल बेस्ड टेस्ट अप्लाई करलु तापर पठै देलु जदि नेगेटिव हला ताले पुनी आपण आरो वर्ष करिवे पॉजिटिव हला ताले आपण को सेकंड स्टेप को जिबाउ पड़िबो जोटा कि कोलोनोस्कोपी नेक्स्ट स्लाइड एटा गोटे इंपोर्टेंट स्लाइड केना आपण केबे भी इग्नोर करिवा कथा नै जल्दी किछि नुवा सिम्पटम्स हला जो भी प्रकार सिम्पटम्स हले रिगार्डलेस ऑफ एज द पर्सन शुड बी चेक्ड आउट बाय द फिजिशियन भाबंतु आपनकर रक्त पडुची स्टूल रु हठात चेंज इन बाउल हैबिट्स हला हठात डायरिया आरंभ हला कि बेसी कॉन्स्टिपेशन हला स्टूल रो शेप और साइज चेंज हला कि मळ द्वार रे बेसी पेन होउची एब्डोमिनल पेन होउची किंबा अनएक्सप्लेन्ड वेट लॉस कि आपण रूटीन ब्लड टेस्ट करचंती से माने देखिला आपण हेमोग्लोबिन बहुत कमिची जदि एई सब सिम्पटम्स किछि रहुची ताहले संगे संग चेकअप करिया दरकार किंतु मन रखंतु मेजॉरिटी ऑफ द कोलन कैंसर बिना सिम्पटम रे इनिशियली स्टार्ट हुए नेक्स्ट स्लाइड प्लीज एटा गोटे सैंपल देखौछु कोलोनोस्कोपी आपण देखिबे जदि स्क्रीन रो आपण को बां पटरे नॉर्मल कोलन देखाउची कोलोनोस्कोपी करले आमे देखिलु किछि पॉलिप नाही जदि गोटे पॉलिप देखिलु से पॉलिपटा जदि आमे किछि करिबुनी से आस्ते आस्ते बढ़ी की एडेनोमा जोटा आमे नेक्स्ट स्लाइड नेक्स्ट येटा अछि सेटा को देखुछु नेक्स्ट पिक्चर रे जदि सेटा बाहर करा हलानी सेटा आस्ते आस्ते बढ़ीबो जोटा कि एडवांस्ड एडेनोमा हला आ इवेंचुअली सेटा कैंसर हे जिवो केना कोलोन कैंसर से मेजॉरिटी सेमती प्रोग्रेस करे गोटे सिंपल पॉलिप रो हे कि एडेनोमा हे कि कैंसर वे जदि से एडेनोमा स्टेज रे आमे ताकू कोलोनोस्कोपी द्वारा ताकू बायोप्सी करी पूरा बाहर कर देलु एसेंशियली आपनकर पूरा कैंसर टा प्रिवेंट हे गेला सेति पई स्क्रीनिंग टा बहुत इंपोर्टेंट एटा होची कोलोनोस्कोपी रो एग्जांपल आपनकर डाहन पटरे आपण देखिबे जोटा कि फिट टेस्ट अछि टिके स्टूल हला पर स्टूल सैंपल लगेले तापर ताकू पोस्ट करले से माने लैब रे टेस्ट करले तार आंसर आसी गेला सेटा भी रेकमेंडेड फॉर स्क्रीनिंग नेक्स्ट स्लाइड प्लीज स्क्रीनिंग रो बहुत असुविधा किंतु वन ऑफ द मेजर रीजन जोटा कि ओसा हेल्थ एंड वेलनेस सेटा को माने स्पॉन्सर करूची आ सपोर्ट करूची हमर मेन गोल होची टू इंक्रीज द कम्युनिटी अवेयरनेस लोक जते जानि परिबे सेते भलो सेते माने सतर्क होई रहिबे ताले तांकर स्क्रीनिंग हे परिबो जानची कोलोनोस्कोपी का को भल लागेनी करिया पई आपण बहुत जगह रे पचरिबे लोक कहबे ना ना मते किछि दरकार नै इन्वेजिव मेथड नेक्स्ट स्लाइड प्लीज आउ किंतु आमे सीरियसली रेकमेंड करिवु जदि आपनकर सुविधा अछि प्लीज गेट अ कोलोनोस्कोपी कहना भाबंतु आपण जदि प्राइमरी केयर डॉक्टर्स मन पाखु जिबे तांको पाखरे 10-15 मिनिट मोटे टाइम मिलुची कहना तांको भी बहुत पेशेंट देखिबार अछि तो से माने आपनकर मेजर गोटे के दीटा प्रॉब्लम देखिबे जोटा कि आपनको असुविधा होची अभिका तनो स्क्रीनिंग टा टिके पछुआ पड़ी जाय इट इज नॉट देयर फॉल्ट बट आपण जदि कहबे मोर बयस हे गेलानी स्क्रीनिंग पय ताले सेही बसरे आपण जाय परिबे नेक्स्ट स्लाइड प्लीज आमे अबिका शिफ्ट करिबा एटा कोलोन कैंसर विषय में कथा हले कोन करले स्क्रीनिंग तार प्रिवेंशन नेक्स्ट फ्यू स्लाइड्स हमें लंग कैंसर और प्रोस्टेट कैंसर ऊपर टिके करिबा जेमती संजय भाई कहिथिले मेजर कॉज ऑफ लंग कैंसर होची स्मोकिंग तेनो स्मोकिंग टा इज द स्ट्रांगेस्ट लिंक इधर डायरेक्ट स्मोकिंग हो कि इवन सेकंड हैंड स्मोक एक्सपोजर हेले भी सेटा होची मेजर फैक्टर दैट एक्सप्लेन्स कि स्पेशली यूएस रे काहे कि बेसी स्त्री लोकन को लंग कैंसर होची कहना मेजॉरिटी अबिका भी आपण देखिबे सोसाइटी रे बहुत स्त्री लोक फेमिनिज्म हो कि जो भी मूवमेंट हो दे स्मोक अ लॉट तो सेति पई से कैंसर इंसिडेंस लंग कैंसर लोकंकर भी बहुत अच्छी रेडिएशन होची अदर रिस्क फैक्टर्स आ एक्सपोजर टू वेरियस केमिकल्स आपण देखिबे सिलिका जोटा कि समस्तंकर घरे हमर जो रहउची डाइनिंग काउंटर टॉप्स तेणु सेटा दैट इज मेड आउट ऑफ सिलिका जो माने सिलिका से एस्बेस्टस जो सब से इंडस्ट्री रे काम करंती से माने सेउडा को एक्सपोज हेतांती बोली तांकर लंग कैंसर रिस्क बहुत बढ़ी जाय आउ जहार फैमिली हिस्ट्री की पर्सनल हिस्ट्री थिबा लंग कैंसर से माने को आउटी सतर्क रहय पड़ी नेक्स्ट स्लाइड प्लीज जदि आपनकर रिस्क फैक्टर्स अच्छी स्पेशली स्मोकिंग जहाँ जो माने बहुत स्मोक करूचंती कि कंटिन्यू करूचंती किंबा विदिन द लास्ट 15 इयर्स भीतर स्मोक करचंती between the age of 55 to 75 again मन रखन तो से 50 to 75 सेटा होची हमर गोल्डन एज बिकॉज़ बयस बढ़िले जो कैंसर टा हुए सेति पई सेटा करा हाइची the best form is low dose CT scan करा जिबा lungs रो that is the major and the only proven way जोटा कि हमें in high risk patients हमें lung cancer screening करू जदि आपण स्मोकिंग करू नांती आपनकर किछि हाई रिस्क फीचर्स नै तनो आपनको रूटीन लंग कैंसर स्क्रीनिंग करिवा दरकार नै so in selected cases हमें सेटा करू जो केना lung cancer like जंती वीरेंद्र बाबू पचारिथिले what about pancreatic cancer these are considered as very aggressive cancers pancreatic cancer unfortunately हमरो किछि नाही अपन स्क्रीनिंग किंतु lung cancer जदि हमें लो डोज सीटी स्कैन करि परिबा ताहले हमें अर्ली स्टेज रे कैंसर टाकू धरिले तार सर्जरी हे परिबो अन्य ट्रीटमेंट हे परिबो बंचिବାର चांस अछि मेजॉरिटी लंग कैंसर एडवांस स्टेज रे देखा जाय जोटा कि इट्स टू लेट फॉर लॉन्ग टर्म सर्वाइवल नेक्स्ट स्लाइड प्लीज अभिका हमें प्रोस्टेट कैंसर को जिबा प्रोस्टेट कैंसर विषय बहुत डेटा कहइतला बट प्रोस्टेट कैंसर इज एन एरिया जोटा कि बहुत रैपिडली इवॉल्व करूची इवन द स्क्रीनिंग गाइडलाइंस 10 वर्ष आगु कोन थिला अभिका कोन अछि दे आर चेंजिंग सो इट्स इन अ फ्लक्स स्टेज किंतु हमें से पई कहा जाय जे prostate cancer screening it has to be done in consultation between the patient and the primary care physician आपनकर हेल्थ देखिकी आपनकर लॉन्ग टर्म गोल्स देखिकी आपनकर रिस्क फैक्टर्स देखिकी सही रिकमेंडेशन टा आसे जेमति ब्रेस्ट कैंसर हमर बहुत क्लियर कट स्क्रीनिंग गाइडलाइंस अछि कि कोलोरेक्टल रो अछि प्रोस्टेट रो समिति नाही किंतु जनरली हमें कहू जदी यू नो 50 इयर्स होची एवरेज रिस्क मेन जो माने को 50 वर्ष अधिक हला African Americans वालांकर ब्लैक पीपल मानकर तांकर टिका हायर रिस्क थाए तेनो जोटा कि हम इंडियन कम्युनिटी को अफेक्ट करेनी बट जानिया दरकार ताले हम सांग मानन भी कहि परिबु लेस 45 हेले तांको हमें रेकमेंड करू किंबा जहार हिस्ट्री अछि फैमिली हिस्ट्री ऑफ प्रोस्टेट कैंसर तांकर से माने टिका हाई रिस्क हेले सिलेक्टेड इंडिविजुअल्स को हमें करिवु अब केमिति करा जाय ना से रेक्टल एग्जाम करिवे गोटे ब्लड टेस्ट अछि जोटा कि हमें को पीएसए प्रोस्टेट स्पेसिफिक एंटीजन तो माने ब्लड टेस्ट रु जानि परिबे जे कोन को लेवल अछि केमिति रेकमेंड माने तापरे सर्वेलेंस कोन करिवु कि फॉलो अप केमिति करिवु आपनक डाक्टर सेटाउ करिवे जदि आपनकर स्ट्रांग फैमिली हिस्ट्री नाही ताले एते व्यस्त हवा दरकार नै फॉर प्रोस्टेट कैंसर नेक्स्ट स्लाइड प्लीज এটা मोर लास्ट स्लाइड द ओवरऑल मेसेज ए सेशन रहउची स्क्रीनिंग सेव्स लाइव्स तो आपण माने इफ यू आर इन द राइट एज ग्रुप कि आपण जे हाई रिस्क ग्रुप अछंती प्लीज कंसीडर गेटिंग स्क्रीन निज पई आ आपण मानकर लव्ड वंस पई between for these 4 common cancers ताले will can you know expect a better long term lifestyle बहुत बहुत धन्यवाद thank you
Shubhashish, that was a wonderful presentation, very detailed. And Dr. Amit Chakravarti also is there. He is a urology surgeon and he is the president-elect of API. Amit, you want to add anything? Amit, unmute. ताको unmute करक पड़िबो की? Okay, I think he may be out. Okay, so the next is
no, hang on.
Okay.
I couldn't unmute myself.
Okay.
So that's why it was taking me a little longer time. Thank you for asking me. Dave and everybody, it's a very, very great initiative. I enjoyed every talk. It was very well done. Thank you for asking me to comment. Prostate cancer, Mr. Rebu, I just want to add a couple of lines. Let me get my, wait a second. prostate cancer actually video ta go on kariya chahe. So that people can see me. Wait a second. So anyway, so prostate cancer, what Subhash said was very right. Prostate cancer is in a flux. Basically, initially, when PSA came out, we were doing prostate PSAs on everybody. Then we realized we are diagnosing cancers which are indolent, which the patient can live the rest of the life without having any surgeries done or any procedures done. Then we realized that. Then what happened was United States Task Force kala bond kar diya sab PSA. Don't do any PSA. So all primary care physicians stopped doing PSA. What happened? 10 years down the road, we saw a spike in the mortality of PSA. Then all of them came together, AUA, American Cancer Society, and they have made guidelines, which Subhashis has pointed out, that it has to be done between 55 and 65 is the peak period. You can stretch it to 50 to 70. So if you're 75 years old, I get patients who have got a PSA done. It's not required. Because your life expectancy has to be more than 10 or 15 years for it to be effective. That is number one. Number two, he pointed out African Americans, and he is also family history of prostate cancer is very important. But what they are saying is that the risks and benefits of diagnosis of the biopsy, diagnosis of prostate cancer, and treatment has to be discussed with the patients and the family practice physician. Suppose the patient has other comorbidities, or the patient really feels that that is not a high enough risk for him to go. For example, I don't feel that I need to get a low-dose lung scan done. So that is a discussion between the patient, and that is what is important today, what Subhash has very rightly pointed out. So having said that, please do not throw the PSA out of the window only because if you're healthy enough, this is a very simple test, just a blood test. You may decide on what to do. Suppose your PSA is more than 10, you seriously have a risk factor there. So PSA is a very simple test. I don't think it should be completely thrown away because we saw the side effects or we saw the long-term effects of what happens when that happens. Thank you.
Thank you, Amit, for impromptu joining in. Next slide, Nagesh. I think that will be the last. I would like to welcome none other than our mentor, Dr. Nanakram Agarwal, Professor of Surgery, New York Medical College, Valhalla, and the guiding spirit behind this academic series, along with Dr. Nitin Doshi. Thank you, Nanak Bhai. Please come in. Nanak Bhai ki unmute kariba ki Nagesh? Nanak Bhai?
While we are waiting, Ashish Bhai, I have to make a correction. The screening for breast cancer should stop at 75, not at 70 as it says on the slide.
Yeah. Nanak Bhai, Nagesh, Nanak Bhai mute.
Nanak Bhai, try now, you should be able to unmute.
Okay. Can you hear me?
Yeah.
Okay. Namaskar. Thank you, Dev Bhai. The word cancer devastates an individual and a family in many ways. First and foremost, I want to thank the leadership of OSA and OSA Health Wellness for initiating cancer awareness sessions. Today is the first, and many more will follow. My thanks to our esteemed speakers. Each one, in an eloquent way, have told us there is a silver lining. There is hope. First, for early or stage 1 cancer, next slide please. For early or stage 1 cancer, the cure rate is over 80% to 95%. Screening helps in early detection. Second, 30 to 50% of the cancers can be prevented by simply changing one lifestyle habits. In Bhagavad Gita, chapter 18, shlokas 37 and 38, Lord Krishna tells us, Yatra tagre vishamiva pariname amritomamam. That is, habits like exercise, yoga, meditation, consuming healthy diet, etc. are like poison at first, but in the end are nectar. In contrast, yat tadgre amritopamam pariname vishamiva. That is, passionate habits like drinking alcohol, smoking, fried foods, etc. are nectar at first, but in the end are poison. Furthermore, Bhagavan Sri Krishna admonishes us, Udarade Atmanatmanam na Atmanam Vasadeyate. That is, lift yourself by yourself and not lower yourself. Therefore, friends, the choice is ours. Everyone needs to take charge of his or her own life, and each one of us can do it. To enhance this learning process further, next slide, please. The New Jersey PA chapter of OSA has organized an in-person session to teach self-breast examination. We will continue, and I hope that the other centers will embark on the similar projects, and we are there at OSA Health Wellness Group to carry this on for more and more. Thank you very much. Please attend and take advantage of this unique opportunity and the unique seminars. Thank you all. Jai Jagannath.
Thank you, Nanak. Thank you, Nanak Bhai. Such a wonderful note you ended. Love you. And now I would like to have Miss Santona Das, our OSA secretary, and the wonderful little sister, smiley face. Thanks for joining and being with us. Please come in.
Thank you, Bhaina. Namaskar samasthanku. Kathare achi, ma mriyasva, ma jahi, sakyate chet mrityum avalopaya. Marana marana, parajadi mrityuko avalupta kara. ଆତ୍ମକୈନ୍ଦ୍ରିକ ହୋଇ ନିଜର ଚେତନା ଶକ୍ତିକୁ ଅଭିବୃଦ୍ଧି କରାଇ ବଞ୍ଚିବା ଆମର କର୍ତ୍ତବ୍ୟ। ଅନ୍ୟକୁ ବଞ୍ଚାଇ ନିଜେ ବଞ୍ଚିବାର ନାମ ଜୀବନ। ଆଜିର ସେମିନାର ଏହି ତଥ୍ୟ ଉପରେ ଆଧାରିତ। ଓସା ହେଲ୍ଥ ଆଣ୍ଡ ୱେଲନେସର ଏହି ପ୍ରୟାସକୁ ମୁଁ ଅଭିନନ୍ଦନ ଜଣାଉଛି। ଅଧୁନା ସମସ୍ୟାକୁ ନେଇ ଆମ ଓସା ପରିବାର କଥା ଚିନ୍ତା କରି କ୍ୟାନ୍ସର ଜନିତ ରୋଗ ବିଷୟରେ ଅବଗତ କରାଇଥିବାରୁ ଆଜିର ସମସ୍ତ ଉଦ୍ୟୋକ୍ତାମାନଙ୍କୁ ମୁଁ ହୃଦୟରୁ କୃତଜ୍ଞତା ଜ୍ଞାପନ କରୁଛି। ସଙ୍ଗୀତା ନାନୀ, ସଞ୍ଜୟ ବାବୁ, ବିକ୍ରମ ବାବୁ, ସୁଭାଶିଷ ବାବୁ, ଆପଣଙ୍କୁ ବହୁତ ବହୁତ ଧନ୍ୟବାଦ। ବହୁତ ବହୁମୂଲ୍ୟ ସମୟ ଦେଇ ଆପଣ ଯୋଗ ଦେଇ ନିଜର ପ୍ରେଜେଣ୍ଟେସନକୁ ବହୁତ ସୁନ୍ଦର ଭାବରେ ଆମ ସମସ୍ତଙ୍କ ଆଗରେ ଉପସ୍ଥିତ କରିଛନ୍ତି। ଦେବ ଭାଇନା, ବସନ୍ତ ଭାଇନା, ନାଗେଶ ଭାଇନା, ଆପଣ ସମସ୍ତଙ୍କୁ ମଧ୍ୟ ଧନ୍ୟବାଦ ଏତେ ସୁନ୍ଦର ଭାବରେ ଏହି କାର୍ଯ୍ୟକ୍ରମଟିକୁ ପରିଚାଳନା କରିଥିବାରୁ। ଆଣ୍ଡ ଅମିତ ବାବୁ, ଆପଣଙ୍କୁ ମଧ୍ୟ ବହୁତ ଧନ୍ୟବାଦ। ଇନଷ୍ଟାଣ୍ଟଲି ଭାଇନା କହିବାରୁ ଆପଣ ଦିପଦ କହିଲେ, ସେଥିପାଇଁ ମଧ୍ୟ ଆପଣଙ୍କୁ ବହୁତ ବହୁତ ଧନ୍ୟବାଦ ଜଣାଉଛି। ପରିଶେଷରେ ଓସାର ସମସ୍ତ ପରିବାର ବର୍ଗଙ୍କୁ ମୁଁ ଧନ୍ୟବାଦ ଦେଉଛି ଏଠାରେ ଉପସ୍ଥିତ ରହି ଓସା ହେଲ୍ଥ ଆଣ୍ଡ ୱେଲନେସର ସଦସ୍ୟଙ୍କର ଏହି ପ୍ରୟାସକୁ ପ୍ରୋତ୍ସାହିତ କରିଥିବାରୁ। ଆମର ଆଗକୁ ଆହୁରି ଏମିତି ବହୁତ କାର୍ଯ୍ୟକ୍ରମ ରହିଛି ଏବଂ କାର୍ଯ୍ୟକ୍ରମମାନ ଆସିବ। ଆପଣ ସମସ୍ତେ ଯୋଗ ଦିଅନ୍ତୁ ଏବଂ ଏଇଥିରେ ସେମାନଙ୍କର ଯେଉଁ ପ୍ରୟାସ ଅଛି ତାକୁ ବହୁତ ସକ୍ସେସ୍ କରାନ୍ତୁ। ଏତିକି କହି ରହୁଛି। ଧନ୍ୟବାଦ, ନମସ୍କାର।
Thank you, Santana, and thank you to the whole OSA executive team for being so supportive and inspired and pushing us to do this. And thanks for your service for the OSA community. And now I would like Dr. Adnan Sadiq to do the question and answers and give it to the speakers. Adnan, are you there? I guess ताको unmute करना पड़ेगा। Nagesh, can you hear me? Nagesh, you are on mute.
Bhai, namaskar. Thank you everybody. Wonderful presentation. बहुत बढ़िया लगला and let's start with the questions. More khali gote din se achi kaya ku ki please doctor visit karantu as much as you all can. Specifically, आजकल many speakers have mentioned कि young लोगों को मजरे भी cancers detect होची. Believe in your doctor. Have faith in them. See them once a year. It's good. We miss you equally when you don't show up. But we are scared when you give us a call in the middle of the night saying, "Hey, Sadiq bhai, good 10 minute achi ki." That's the worst statement to hear in the middle of the night. Any questions?
Dr. Sadiq, there are some questions in the chat. You probably could start there.
You know, there was a question that let's start with the prostate. Do all men have prostate problems as they age? I think Dr. Amit Chakravarti is still here with us. Does he want to take that question? He's a urologist.
Amit, are you there? Maybe he dropped off, I think.
So the only thing I can tell you is prostate problem will happen to every man. Every aging man will have a prostate problem, but it necessarily does not mean cancer. But like Subhashish mentioned that a physical exam, a screening blood test is vital for you. If you have any symptoms, what is the symptom? Basic parisra laguchi. Ratri uthchanti apana. You can't control your urination. Anything of this sort. Anything that is like a couple of speakers mentioned, anything out of what is natural to you, you should seek opinion from your doctor, from your primary care physician. And they know the best. And trust me, even if it is 15 minutes they're spending with you, there are guidelines in this country that they will follow and they will do their best.
At this point, everybody, whoever wants to speak can unmute yourself. So feel free to unmute and ask your question.
While the question's coming up, I just want to elaborate on that prostate. Adnan has mentioned that. I think the people should know that all benign hypertrophy prostate doesn't mean that it is cancer. A lot of people get scared that I have a large prostate, so it has to be cancer. So they are not cancer. Only out of that, only 2.5% of that could go into to have a cancer along with the benign hypertrophy prostate. Just wanted to clarify that.
One question for Subhashish. So what kind of cancers are hereditary? I'm just asking Subhashish because he's the surgical oncologist and he's my junior, of course. I'm going to support him a bit more. Just joking. But he is a cancer specialist. What kind of cancers are hereditary?
And Nagesh, they cannot unmute. Nagesh, they cannot unmute.
They cannot. Working on it. When I'm working on it.
Just hold on 1 second. Give it.
Just if somebody's on phone. Okay. So go ahead.
Thank you, Sadiq bhai. So majority of the cancers are sporadic. Up to maybe around 10% of cancers have a genetic component or what we call as hereditary. Breast cancer amara bahut advances eichi jota ki ame different genetic testing achi ame ta pai koruchu, BRCA1 testing, BRCA2, breast, ovarian cancer, some forms of colon cancer. এই সব ক্যান্সারে বহুত সাইন্স আগেইছি যেটা কি আমি জেনেটিক কম্পোনেন্টস তারা বেশি জানি পারছু among common cancers. কিন্তু most cancers are random, sporadic. ତେଣୁ କାହାକୁ ହେଇଛି ବୋଲି ଆଉ ଜଣଙ୍କୁ ହବ ସେମିତି ନାହିଁ unless and until ଗୋଟେ genetic mutation test ଜଣା ପଡିବ ଯଦି genetic mutation ଅଛି ଯଦି ଜଣେ ଫ୍ୟାମିଲି ମେମ୍ବର ରହିଛି ତାହେଲେ ଅନ୍ୟ ଫ୍ୟାମିଲି ମେମ୍ବର୍ସଙ୍କର ହାଇ ଚାନ୍ସ ଅଛି ତ ଯୋଉଟା କି ଆମେ ବ୍ରେଷ୍ଟ କ୍ୟାନ୍ସରରେ ବହୁତ ଦେଖୁ ବ୍ରେଷ୍ଟ ଆଉ କୋଲନରେ।
Adnan, can I
Yes.
Can I speak?
Yes, absolutely.
Yeah, this is Basant Mahapatra. So, it is a very important questions. Both genetic, we, about genetic testing and thing. Remember, Amar Jane Hollywood star, tanker BRCA positive hela. She had double mastectomy. I don't know if she had any cancer there. So, recommendation is now, suppose you have a genetic testing positive, doesn't mean you have to go through surgery or anything. It's just surveillance. Because, yes, chance of cancer high, but not that you're going to get cancer. So basic thing is you come back to the thing, the cancer, how the cancer comes. If everyone understand how the cancer comes at cellular level, we know we are doctors. So there is a study was performed. I'll give the example. They scientists took a cancer cell and removed the nucleus. Okay, I'm cancer cell nucleus ta काट देले जोटा कि genetic cancer जो हमें को just regular cancer out a normal healthy nucleus पूरे देले. They found the cancer still didn't have any impact. It keep going. Similarly, they do the other way also. So this type of test shows that genetic cancer जो कहूँ is not, but cancer is not caused from any DNA issues. It caused mostly our mitochondria problem. In the problem mitochondria, there is a damage to mitochondria from different carcinogens, different inflammation. So seda hela pare, that mitochondria which gives supply energy to the cell, all the cellular activity, that become dysregulated. Therefore, our cell division way. That is the cause of cancer. Most our scientists found, not that genetic. So we don't have to emphasize too much genetic. Yes, you should have genetic testing. Then see your doctor. But most important is your lifestyle changing, like they already discussed. That's why you control your cancer.
Next question, Adnan. Next question. Thank you, Vasant Bhai. Next question, Adnan.
Now you should be able to unmute.
Yes. Any other questions? I don't have anything on the chat.
No, you had, for example, somebody, Radha Krishnan, wants.
Bhai, can I ask question in person?
Sure,
Yeah,
sure.
sure.
Of course.
Please.
Sorry, my phone.
So while you are picking up the question, there's a question. Let me throw it out to Adnan. Once detected and treated, what are the chances of relapse versus never relapsing for the same type of cancer? Subhashish, you want to take it?
Sure. So it depends on the cancer. Is it completely removed? Na nahi se answer dekha jaye. Kintu there is always a risk. Globally speaking, overall speaking, there's always a risk of a relapse for that particular cancer. Sethipai ame aji jota discuss karlu, that was more focused on screening and prevention ideally. Hore kintu cancer hela pore ame tapre once the basic treatment is done, jota ki depending on the cancer ko type stage, surgery, chemotherapy, radiation therapy, these are the three major pillars for cancer treatments. Hore say treatment hegala pore, we take the patients to the phase known as surveillance. Kinda the risk of relapse is high. Our surveillance again depending on the cancer, ame kete frequently karibu routine test, blood test ho ki au kichi imaging karibu. So it depend on the cancer, but patients are always under surveillance. Gradually, as they go away from their initial time of cancer, tankara relapse ta kami jaye. But for the first 2 to 5 years, ame closely tanku follow karu. Au tapare semane puni routine surveillance process re jibe. So there is always a chance for relapse. That means surveillance is very important.
Thank you.
Thank you. Chat re avode question. Chat re avode question thila, can non-smokers
Adnan, somebody is raising the hand. Take them first because they are waiting. Then we can go to the chat.
Okay. Yes. Go ahead, Miss Pragya Pradhan.
Yeah. Thank you. Samastanku namaskar. A question actually more sister-in-law pai. She recently diagnosed ovarian cancer, and with the she has removed her ovaries and uterus, and it's a clear cell carcinoma, and she has recommended for 6 chemo. So she has done with her 5th chemo, and next month she will completed her 6th chemo. So my question is like, what is the further treatment? Is there any like better facilities here? She is in Bhubaneswar. So is there any better facilities than Odisha? She can come and treated her. And what is the chances of relapses?
Let me take this question. So thank you, Pragya, for the question. And I know it's a personal case, so this is very serious. Here, Amorati, Scopre, we don't suggest any treatment. Okay, this is, we discuss about prevention and screening, but you can contact me or any of our member personally in our phone number, and we will be able to guide you and to the right person in Odisha, Cuttack or Bhubaneswar. Where is she? Cuttack na Bhubaneswar?
She's in Bhubaneswar.
Okay, so we can guide you. We have a professor of gynec in SCB and other places, so we can guide you there. We will be able to give you proper guidance. Okay.
Okay. Thank you.
And do not forget to reach out to us. We will help you here. We are here for that reason.
Yeah.
And there are, and on the same note, I just wanted to know that all these cases are individualized, as Dr. Subhashish had mentioned. Every case is different. And yes, among all of us, we are almost known to everyone there in Bhubaneswar. So don't feel alone and don't feel helpless. Just reach out.
Thank you so much. Thank you.
And then Miss Anita Patel has given a very deep question. And if you want to pick up, or you want me to read it?
Please, go ahead.
In case of breast cancer, doing mastectomy first and then chemo versus chemo followed by which process is preferred? Option.
Sangeeta,
which process?
So I had responded to this answer personally to her because this is pretty detailed, and I told this takes the whole team, the patient, primary care, the breast surgeon, oncologist, and radiation oncologist, depending on the stage of the cancer. And then only decision can be made.
Yeah.
There is another question on the chat. Can non-smokers get lung cancer? I know Subhashish had mentioned, but I guess that question definitely needs a little more explanation. Anyone, Dr. Thomas is online. He should say something.
I'll give him the question Nitin Bhai posted. I think recent use of total body MRI for early cancer detection.
The question is, can non-smokers get lung cancer? We'll go to your question.
Okay. Go ahead. Sorry, Vijay, go ahead.
Yeah. I mean, non-smokers, definitely, because we had, I remember we had a surgeon who's now a smoker, but he definitely got cancer and finally passed away from it. So non-smokers will get lung cancer. They may not get the squamous cell type. They may have some other kind of large cell type cancer. So yeah, the squamous cell cancers may be more common in smokers, but not the others. Yeah. And actually, I had one more point about the prostate thing. I know there's a lot of confusion about doing PSAs and all. As a primary care physician, what I do is I do recommend doing PSAs. And the big thing is to know your PSA value each year, because the range is from 0 to 4. So basically, if you're running 1.2, 1.2, and it may be 1.34 in the next 4 or 5 years. So if you see a spike in your PSA going from 1.2 to maybe 3.9, you're still not below the normal range. That's still a concern if it's spiking. So that's called PSA velocity, which I think nobody touched upon that. Because that's something that we all have to know, because you have to do your PSA yearly. And from there, you kind of extrapolate. If it's kind of gone up too quickly, you have to repeat it about 3-4 months, see if it comes down. If it comes down, good. If it's not, then you have to kind of address it with a surgeon. Yeah.
That's a good question. Actually, we discussed today. Me and Basant, we were discussing. Yeah, doubling time or rising time.
Yeah. So Devasis, about the smoking, a non-smoker can get cancer. Now, I think somebody mentioned that now obesity overtaken the smoking as one of the causative factors of cancer. Is that right?
Yeah, that's true.
Yeah, so
because you have
that means like smoking is bad, but remember obesity or overweight is been worse. So you can get any cancer from this. So.
Mm-hmm. So next question, what an interesting question. Let's go to the question quickly, and that is Mr. Tapas Jana. Are you there, Mr. Tapas Jana? So his question is:
Yes, I am there. Yeah.
Okay, good. Is Cologuard screening accurate, and how frequently we need to do the Cologuard screening? Subhashish?
Sure. So Cologuard screening होची गोटे तार गोटे genetic component अछि जोटा कि हम कहूछु जदि आपनक देह रे abnormal cell रहउची सो सेटा बेसी जल्दी रेप्लिकेट करे से सेल गुडा आ जते जल्दी से माने बढ़िबे सेते जल्दी कोलोन लाइन रे आसीबे स्टूल रे आसीबो सो कोलोगार्ड टेस्ट से abnormal cells गुडा को इजीली डिटेक्ट कर दिए किंतु जदि सेटा पॉजिटिव हला ताले आपनकू कोलोनोस्कोपी करिया पड़िबो रिमेंबर सेटा इट्स अ 2 स्टेप्स टेस्ट प्रॉब्लम होची कोलोगार्ड रो कोन जदि केना एटा से ब्लड डिटेक्ट करनी इट्स डिटेक्टिंग डीएनए एंड abnormal डीएनए इन द सेल्स तापर कोलोनोस्कोपी जदि नॉर्मल आसिला then people are lost ki the next recommendation kona should we just go for routine colonoscopy or we just tell you ki apanଙ୍କର ଗୋଟେ genetic component ରହୁଛି ଯୋଉଟା କି it puts you at a higher risk but there is no cancer right now typically Cologuard ଯେତେବେଳେ ସେମାନେ ସବୁ କରିଛନ୍ତି ସେମାନେ କହିଲେ as an alternative test once every 3 years ରେ ବି ହବ but ତାର disadvantage ଟା ଆମକୁ understand କରିବାକୁ ପଡିବ so best is ଆପଣ primary care physician ପାଖକୁ ଯିବେ and whatever they recommend ତାପରେ ସେ ଆପଣଙ୍କୁ ସେଟାକୁ help କରିବେ to follow up
go to the
thank you, Amit. Let's go to the next question. Adnan asked. Thank you, Amit. Let's go to the next question. Adnan asked. We have a bunch of questions. We have
now that about Devasis. That is good question. Somebody asked about infection. What is the question?
Yeah,
again?
the question
Adnan,
was
please,
the question was if repeated pneumonia and COVID occurs to an individual, does the risk of cancer increase?
Yes, absolutely. There is high risk. Risk increases. Like I mentioned earlier, that body when it's an inflammatory state. Jodi body re gote any sorts of inflammation asila, so chance is there. It increases because remember I told you guys that cancer one causative cause of cancer is damage to the mitochondria and the cell. Any inflammatory state can cause damage. So yes, that is a high risk. Not that I'm pneumonia cancer. Same nahi, but yes. So we have to. So any condition we have to avoid any infection. Like we mentioned, like Sanjay mentioned in his slide. Yeah.
There is a wonderful question. Next one. The question is, what kind of cancer risks increase with obesity, or is it broad spectrum covers all cancer?
I think everything.
This question was asked by Julie Parida Swine. Very good question.
Yeah.
Sangeeta, you want to take that question? It's a question related to breast and endometrium.
Yes. So a lot of them. So my theory regarding this is exercise is a answer to most of the medical problems because even for the heart. So when you are exercising your heart rate, you are pumping up, then you are increasing the blood flow to all the cells, and that really helps to keep your body at a cellular level healthy. Having said that, breast cancer, endometrial cancer, colon cancer, big risk factors. Obesity is a big risk factors because there's more fatty tissue in the breast, and that definitely can cause increased risk. So exercise, honestly, is definitely, I would encourage everybody, even if it's just a brisk walk, just going out in the nature and getting fresh air.
I mean, like in short form, yes, obesity can cause every kind of cancer. Can happen.
Sadiq bhai, the mechanism जोटा कि हमें को obesity कहीं की cancer करूची, it causes a variety of cancers. I think Sanjay bhai ताकू बड़े बड़े slide से देखी थी common cancers जोटा कि obesity, including esophageal cancer, kind of cancer type भी change होची. Chronic obesity causes a form of chronic inflammation. ଯେମିତି ଆପଣ ଦେଖିବେ କାହାର ଗୋଟେ burn ହେଲା inflammation ହେଲା ସେଇଠୁ cancer ହବ so obesity once it is person is obese you are at a heightened state at a higher state of chronic inflammation that will let rise to variety of cancers so ସେଥିପାଇଁ ଓଜନ କମେଇବାଟା ବହୁତ important not from only from a beauty standpoint but more from a healthy living standpoint.
Sanjay bhai କିଛି କହିବେନି? Sanjay bhai had a very good point on that.
Right, he had a good slide.
He had a very good slide. Sanjay Bhai I think he's stepped out. Anyway, next question is it mandatory to give HPV vaccine? How many doses and what is the ideal age? So in that particular question, I can tell you for sure, Sushmita is not here, I'm sorry. HPV vaccination is mandated. It should be starting as early as 9. Being married to a pediatrician, I know this much. And in the Indian subcontinent, cervical cancer has a very high incidence. So that's why we are all pushing for HPV vaccination. Even in the United States, it's very high. Subhashish, correct me if I'm wrong. He's a surgical oncologist. He knows more than I do. And the routine vaccination is recommended for all adolescents. And I'm forgetting. There is a possibility of catch-up vaccination. If you've not been vaccinated, come and get it later on. Now there are vaccine types. There are 3 or 4 types of vaccines. Normally is Gardasil 9, Cervarix. Your pediatrician will definitely offer these things. So it is definitely important that she had specifically said before sending your child to the dorm, make sure that they definitely are vaccinated against HPV. Of course, the other routine vaccines are meningococcal and stuff, but HPV vaccination is warranted before they go to the dorm.
Yeah, thank you. Next question, Anna.
When it comes to dense tissues identified during mammograms, what's the risk in terms of cancer?
So Sadiq bhai, I can take this.
Yes.
So generally dense breast tissue, it just means that it has got nothing to do with cancer. It's just that when younger age women tend to have more dense breast tissues. So the problem kon hue जे अति डेन्स ब्रेस्ट टिश्यू हेले स्क्रीनिंग जो मैमोग्राम आमे करू से डेन्स टिश्यू रे सब जिंस जना पड़िबनी इजीली तो सेही केस रे आमे रेकमेंड करिबु जे इधर दे गो फॉर अ डायग्नोस्टिक मैमोग्राम नो नहीं 3D मैमोग्राम बहुत सेंटर्स रे आजिकली हे गलानी 3D मैमोग्राम सो दोज आर वेरी गुड टू असेस the presence of any precancerous lesions or calcifications in the breast.
There's another question from Ms. Sanghamitra Guru. Is there any side effects of oral cancer in case of breast cancer treatment? Are you there, Ms. Sanghamitra Guru? Can you please elaborate on your question?
Yes, actually I'm here. But I'm in New Jersey and most Sanaboni breast cancer affected. She's in stage 3. So initially, semane taro radiation, chemo and all those correct treatment kale. But after the final surgery and everything was done, before surgery they did a pre-check ki kono baki cancer rahi jaichi ki kono ye. तो सेतेबेले से मैंने फाइंड आउट करले कि तार मेमोरी ग्लैंड रे कैंसर रो ये अछि एंड इवन दो ब्रेस्ट सर्जरी सरिला परे भी तार रेसिडुअल रही जायछि सो दे से दे डोंट हैव एनी ट्रीटमेंट फॉर दैट apart from like focused radiation and oral chemo. So I just want to know, is oral chemo ro kichi side effect achi or is it that painful as normal chemo? Like what she has already gone through, she had almost 16 chemo sessions. So is it equally painful and any side effect of the oral chemo?
Subhashish, you want to take this?
Right, sure. Sanghamitra madam, so see IV chemo nahi sarchanti. Oral chemotherapy बहुत थोड़े just maintenance pain दिया जाए कि जो चीज माइक्रोस्कोपिक फोकस कैंसर रहेगला सो एटा पेनफुल लेते करिबनी किंतु एवरी मेडिसिन आपन देखियो पड़िबो इज अ पॉइजन राइट तो तार किछिटा साइड इफेक्ट हबो बट देयर इज अ रीजन काई तांको ओरल दिया होची बट कंपेयर्ड टू आईवी कीमोथेरेपी पेन और अन्य साइड इफेक्ट्स विल बी क्वाइट लेस
एंड आ गोटे जिंस भी हमको बुझिया को पड़िबो जे आमे मेडिसिन ता नौचे बिकॉज़ हमको नबाको पडुची we don't want to deal with the cancer so जे कोनोसी कीमो हो कि जे कोनोसी मेडिसिन हो आमे सेटा नो सेटा से बैड सेल्स को जेतेबेले किल करिवो किछिटा इफेक्ट तो गुड सेल रे रहिबो but we take the calculated risk it's risk versus benefit right जदी बेनिफिट ता अधिक हम टिके रिस्क नबा
अच्छा बट देन जोड़ा कि नॉर्मल तरह केमो और रेडिएशन हील हेई पारलानी जो रही जायछि रेसिडुअल एंड जो मेमोरी ग्लैंड रे जो कैंसर सेल्स ग्रो होची सेगुडा को रेडिएशन ओरल केमो रे ठीक हेई पारिबो ना देयर इज नो गारंटी ऑन दैट
It is
Madam,
definitely better to take a chance with treatment than not. Kaina jodi non number to auri worse habo.
ଯେମିତି ଦେବ ଭାଇ କହିଲେ ଏଟା ବହୁତ ସ୍ପେସିଫିକ କ୍ୱେଶ୍ଚନ ୱିଦାଉଟ୍ ଲୁକିଂ ଆଟ୍ ଡିଟେଲ୍ସ ଆନ୍ସର କରିବା ମୁସ୍କିଲ ବଟ୍ ଯଦି ଅପସନ ଅଛି ଟ୍ରିଟମେଣ୍ଟ ର ଅଲୱେଜ ବେଟର ଟୁ ଗୋ ଫର दैट ଅପସନ
Sangamitra ma'am, in this particular thing re मैं एती कहना चाहूँगी, everything has is weighed as risks and benefits देखा जाए. Typically oncologist अचंती मैंने कर्कट रोग विभाग रो जे डाक्टर अचंती से मैंने तांकर गोटे tumor board वे they put up all these cases into that forum, discuss करती, and you know every individual case is different. It's not one cure solves treats all. इटा हुए नहीं एमती हुए नहीं तो all cases are treated differently. Their risks and benefits are weighed. किए tolerate करिबो किए tolerate न करिबो कोन side effect होबो सब जिन सब देखिया परे the team comes to a treatment strategy सेटा को दिया जाए and तारो सेथिरे से मैंने decide भी करंती केते बेले आपण कोन कीमोथेरेपी हबो किबा रेडिएशन हबो किबा आपण ओरल औषध खाइबे किबा आपण कीमोथेरेपी आगे नेबे तापर सर्जरी को जिबे किबा रेडिएशन देबे. So every cancer has different approach to be treated. It depends on the staging, type of cancer, the age of the individual, both things are changing. So this is typically usually US रे हमें US रे कोना India रे भी आजकल tumor boards हेलानी and people discuss. Actually, doctors sit down and discuss everything and make a final treatment strategy that is presented to the patient. And if we can help you in any way for your sister, we are here to help. Thank you for the wonderful question.
Beautiful answer. I would have help kar do chis Adnan Gudike. Are there any standardized screening for cancer available in Bhubaneswar to check and prevent relapse in elderly? Vijay, you want to take?
What's the question again?
Are there any standardized screenings for cancer available in Bhubaneswar to check and prevent relapse in elderly?
I guess.
Which cancer?
I mean, yeah, it depends on the cancer. You know, what kind of cancer and all. Yeah.
So the question is not very specific. So it depends on the type of cancer, the type of staging, the type of treatment, and then what needs to be done to.
I think we discussed for colon cancer like.
Let me do it for a couple of things. I think for colon cancer, they start with the colonoscopies at least every 5 years, maybe even sooner.
Yes.
So that's to be done. For prostate cancer, yeah, they can do PSAs or the new available blood tests. So it depends. It's all cancer specific, yeah.
But Vijay, they don't do colonoscopy in Bhubaneswar after this age, but they recommend. I know they recommend prostate PSA. But they don't do.
बसंत भाई आजिकली करूचंती हाई रिस्क जहार अछि आपण चाहिले जाय कि करि परिबे. आजिकली इंडिया रे भी माने इंडिया रे नेशनल गाइडलाइंस नाही कैंसर स्क्रीनिंग पई पॉइंट.
ना हाई रिस्क न जे द क्वेश्चन होची जे से एनी स्क्रीनिंग but we don't do screening in Bhubaneswar for colonoscopy corona.
No, not only in Bhubaneswar, India रे हमर सेंती standardized recommendations नाही केना population ए सब cost देखि की but selected centers रे होची त तनो जदी गोटे family they are worried for whatever reason, maybe तांकर personal family history अछि, हमें recommend कर परिबे जे you go and see your physician and then let them decide कि कोन कोन दरकार हबो.
Yes.
Bhubaneswar रे गोटे gastroenterology center अछि डॉक्टर दळई करिकी अछंती. He is pretty famous there in Bhubaneswar. Utkal Hospital रे they provide colonoscopy screenings. Utkal Hospital is actually owned by physicians from the US. Amari Odisha ro lok achanti. They're based from Texas. So they have preventive medicine practiced in Utkal Hospital. I know for sure.
Thank you. So basic question, there is no standardized test to screen for any relapse. Answer is yeah.
Now the next question कहउथले गोटे MRI विषय. Can I go ahead and answer that? मु तांको personally answer करथिली.
Sure, go ahead.
आजकल US रे बहुत centers हलानी जोटा कि private equity, private investors set up. They're doing whole body MRI scan. Right? So ସେମାନେ कहउचंती $4000 द जिबे आपण cash pay करिके whole body MRI कर देबे. That is not recommended. It is a marketing gimmick. There's no other way to put it. तेणु जदी it only gives you a false sense of security. So that is not recommended.
Subhashish, you should also mention it. What people do usually, amaro bhai mane se mane pale janti India pale janti sethi jaiki kari niyanti because it is cheaper out there. This is absolutely not recommended.
It was like doing an annual stress. There are a lot of unethical things are going on there, so we can't discuss that.
The question, let's go to finish up quickly. I have a couple of questions. biggest cause of growing numbers in cancer? What is the biggest cause in growing number of cancer? Anything we can handle on this? Anybody can take it.
Biggest cause
of growing number in cancers. Is there any way how we can handle it?
Well,
you know,
go ahead.
The most important part is early diagnosis, preventive medicine. People are more conscious and aware. They go to their physicians. But unfortunately, we have seen amidst Indian immigrants specifically, their faith in their doctors is still not built up to the level that we have in the Western world, which it's an appeal as a physician to you all. Please believe in your doctor. Your doctor is not here to make money. They are working under guidelines. They're working here for you. And they've given up everything. They are trying to just be there for you. So if you just visit your physician once a year, that'll be awesome. And just, I know there are experts here. Mukhali Gotis, real-time story. There was a lady who was coming to the US. US Ashwanti, why don't you just go for your health checkup back home in India and then just come? They were having issues with insurance here. So lo and behold, just 2 weeks ago, she was diagnosed with a breast cancer. And luckily, she was diagnosed in Hyderabad and she's getting the treatment. Instead of coming to the US, she got early diagnosis and got treated for that. So that is the most important thing. Early diagnosis, better diagnostic features, physicians being on the lookout for these things. That is, I think, the biggest reason that we have very high numbers. Of course, Subhashish, being an oncologist, will have more answers, more points.
Sadiq bhai, I think Sanjay bhai got a bhalo slide deythile. I think the short answer is multifactorial. We don't have all the answers, but ame dekhuchu bahut karan jogu apana smoking diet, lifestyle factors, smoking, alcohol, tobacco, obesity, exposure to chemicals. US re apna dekhibe, especially amar sabu jinsa chemical, we want to smell good, look good, everything. Ame doctors office jauchu sethi bhalo basna hochi, to natural jinsa ta amar kami jauchi. We are exposed to a lot of chemicals. It's multifactorial. Plus people are living longer. Cancer is a disease of old age. So the lifestyle body sette cancer habo. Good example, if you biopsy the prostate of a 90-year-old or the breast of a 90-year-old woman, you will find cancer cells there. So it is a natural process. The boys body like cancer be body, but people die of other reasons than from cancer at that stage of the game. So it's multifactorial.
Thank you.
My take about annual physical exam, you are paying for it, your insurance is paying for it, and everything, your exam and blood work is covered in it. Please make use of it.
Thank you. That's a very important point. Mr. Manoj, are you there? There is a question that you wanted to ask on thyroid, and you want to ask it yourself?
Yes, and thank you very much. It's a lot of great information. Again, I'm thinking of, I read somewhere like thyroid cancer, and I'm asking if anyone has any thyroid problem, like maybe hypothyroidism. I know if you go here, doctors give medicines that's controlled, but taking this medicine for longer term, so will that lead to any terms of cancer or any other cause that might lead to thyroid cancer?
I can take this one. Absolutely not. So hormone hochi, you are born with certain amount, jemti insulin, semti thyroid. For any reason, inflammation hela, kichi hela, seta use up hegala. So there's a shortage in your body and you need that hormone for everyday activity, metabolism. Jodi no khaibe, gradually seta body chalibo. Certain stage achi kichi symptom nahi, bahut kam body chi, tahale monitor kari habo. Kintu sabu barso check up karebe seta. But thyroid, thyroid cancer na, seta kariboni.
ଆପଣଙ୍କର ଥାଇରଏଡ ହାଇପୋଥାଇରଏଡ ହଉ କି ହାଇପରଥାଇରଏଡ ହଉ ସେଟା ହଉଛି ମେଟାବଲିକ କଣ୍ଡିସନ୍ସ ମାନେ ହରମୋନ ଲେଭେଲ ଉପରେ କିନ୍ତୁ ଯଦି ସେମାନେ ଚେକଅପ୍ କଲା ବେଳକୁ ଅଲ୍ଟ୍ରାସାଉଣ୍ଡ କରିବେ ଯଦି କିଛି ଥାଇରଏଡ ନଡ୍ୟୁଲ ଦେଖିଲେ ସେମାନେ ତାକୁ ତାପରେ ସର୍ଭେଲାନ୍ସ ରଖିବେ ଡିପେଣ୍ଡିଂ ଅନ୍ ଦ ସାଇଜ ଅଫ ଦ ନଡ୍ୟୁଲ beyond a certain size ସେମାନେ recommend କରିବେ biopsy ପାଇଁ so it's a staged process best thing is ଆପଣ continue to follow up with your primary care for your routine treatment they will keep an eye on it.
Okay, thank you. And I got a follow-up question. Again, I got a common diabetes, right? We're talking about obesity, but diabetes physically भी चली थी. even it can be diet control. Some किछि लोक ताको follow करचंती, किछि लोक medicine भी नहीं control करचंती, किछि लोक insulin नहीं. So diabetes रा किछि भी role अछि कि contribute करिवारे cancer रे?
Yes. Bikram, yes. It's directly linked to that long-term type 2 diabetes leading to specifically pancreatic cancer. And we have seen that quite a bit of that. In my practice, I've done about 500 surgeries for pancreatic cancer, actually 700. And a lot of them had long-term diabetes. Yes, it's linked.
So,
thank you.
diabetes causes what? Like I'm a diabetes causes like hyperglycemia, high glucose level, is that right? And high glucose level causes inflammation of the whole body. And inflammation is the cause of the cancer. It can cause any cancer. Diabetes is.
There's also one extra thing, most diabetics and even pre-diabetics have they are hyperinsulinic. They have quite a high level of insulin. If you check someone with pre-diabetes or diabetes, they have 2 to 3 times the level of insulin. And insulin itself is growth promoting. So if you look at it, it's a growth promoting hormone. If you look, you have skin tags and this and that coming out. So if you have a chance of cancer with more insulin, yeah, there definitely is more chance of it's flaring up.
And another thing is also जो inflammation हुए, pancreatitis, acute, chronic, that also can be a trigger for diabetes and pancreatic cancer. Like
I have
Mr. Mahesh Jalan has a question. He asks, I have a question about high school mentoring and not cancer. What is the right forum for that? I'm trying to plan for a summer. I didn't get the question, Mr. Mahesh Jalan. You want to ask that question?
I will answer. I will answer that. Mr. Jalan had sent an email. Mr. Jalan, we are very busy. We will get back to you. Okay, don't worry. And you can reach out to me in my cell phone. Okay, we just had a talk today. So we are having deaths in the community, so that takes priority. So we'll open up your email and we'll get to you. Okay, and if you can have my number 404. Write it down. 404. Okay. 985. 7296. Thank you.
Thank you.
We'll get to there, and we are sorry we could not answer
no problem.
Your email.
You guys
we had sent. Yeah, we will get to, but you can text me, okay? And I'll get to you. We can talk today. So another last question, conclusion is interesting for Bikram bhai. What type of cancers are hereditary? That's the last question, I think. Right?
Subhashish, I think, had answered this question, but Bikram, sir, go ahead. Please answer the question.
Yeah, everybody has already discussed that about that. Most common, because we are talking about the highest incidence of cancer, is the breast. Strongly hereditary link. Colorectal cancer has a strong hereditary link. These two. And the third one is the ovarian cancer.
And also melanoma can be.
Yeah, well, melanoma is more environmental exposure. What was the research was done by the Sunbelt Melanoma group. And
prostate cancer too to the family risk. Yeah.
Prostate may be questionable, but it does have some hereditary link. Yes. At least the 3 most important things are the breast, colorectal, ovarian cancer.
But that doesn't mean they will get cancer if they follow the guidelines we discussed.
Right.
Like lifestyle modification. They may not get cancer.
Right. So Basant bhai, got a slight clarification. Certain kinds of cancers have a high penetrance based on the genetic influence.
Yes.
So say jagare, I may actually recommend koru, they have to get prophylactic surgery. Khali screening test seta chalibani. Apuna dekhibe ulcerative colitis achi, you have a high risk of developing colon cancer, Lynch syndrome rahila, BRCA1 and 2 upon jo kahutile Hollywood actress Angelina Jolie, she actually nala, that is a recommended treatment that if you are BRCA positive, BRCA1 or 2 positive, you undergo prophylactic mastectomy. That is a recommended treatment. Kana taro screening kariki once it becomes cancer, then it's a problem. किंतु अन्य किछटा genetic factors अछि जोटा कि आपण surveillance आपण जंती कहले screening करके you can maintain. So depends on the cancer रे thyroid cancer किछटा अछि जोटा कि हम recommend करिवु men syndrome हला हम जल्दी surgery पे recommend करिवु. So it depends on the cancer.
So
even here
Khali just to sum up mu kaya chahunchili, I know we are all trying to run out of time. So there are a couple of cancers definitely. Mu khali list padi devi, the experts have already mentioned this. I would definitely advise ke eta apna primary doctor saito definitely that would take it up. But just to give you a list, if you're writing it up, it was said, breast cancer, colorectal cancer, ovarian cancer, thyroid cancer, kidney cancer, prostate cancer, pancreatic cancer, of course. These all have a genetic component, but the most important thing that you should take home is if you have it in your family, tell it to your primary care doctor. They have the expertise to take it further, how to give you a better quality of life. OSA Health and Wellness only goal and target is to make you aware as to how to have a healthy, good, preventable lifestyle. I've got a question asked you, Ms. Sanchita iPhone. I have a question regarding breast cancer. Ms. Sanchita, are you still on the phone?
Hi, I am
Go
there.
ahead.
Okay,
Sangeeta madam is there. She'll take your question. Go
okay,
ahead.
sure, thank you. So I wanted to want to know that recently the case which happened, so we all are traumatized with that case. But how could our friend could have been get the better treatment if she knew that it has been occurred in her body?
I know it's a very emotional stage you all are going through more than us. But at the same time, we have to understand there are certain things that's beyond our control. And I will be there in person tomorrow and we will discuss more in detail in person. Just for now, just follow the standard recommendations. Because there are conditions, I will discuss cases that I have had in my practice, and just unfortunate. People can still do everything that you need to do, and accidents happen, right? We take our car for servicing, pull out, and there's an accident. That doesn't mean the servicing wasn't done. But at the same time, we have to do our due diligence, and we'll go through details tomorrow.
Okay, sure. Thank you so much.
Yeah, thank you. So I think we are done here. I thank everybody. If everybody wants to come in the video, I would also like to acknowledge our Dr. Durga Madhav Mishra.
You don't have to do anything. I just appreciate all the doctors, so enthusiastic to help the community. They are spending their Saturday afternoon or Saturday morning coming forward and doing this thing. This is fantastic. This is just beyond fantastic. So
all participants, everybody, whoever wants to come on camera, let's take a
shot. Please come on camera. And I would also like to invite Sarada Ponda, our Vice President of OSA. Where is he?
Thank you, Debbai. Thank you. Actually late join kali. Again, thank you everybody. For joining this call, all the members, and I would thank all the doctors here for sparing your time, important time, and sharing the lot valuable information with the members. And thank you everybody.
We should do a continuing session of this part 2, a lot of things are not answered. Yeah, we should do a continuing session of like part 2.
Please, everybody come on video. Nagesh, can we take Nagesh?
And right, we should have a continuing part 2 session for this, right?
Yeah, we will have. But we would like to have,
because this is very useful, yeah.
Okay, last call. Anybody else wants to come on video, please?
Please come on camera. Video. Everybody,
and say cheese.
Achana.
आपनो चीज दवा पड़े बुझले खाली चीज कहला बनी.
Okay, smile everybody. 1, 2, 3.
Oh man. Ready.
Okay. Smile. 1, 2, 3. Okay, I got the picture.
Thank you all. Thank you. We had a wonderful session. I knew that, thanks to all the speakers, thanks to all the participants, and thanks to the OSA executive and the community for coming. And you encourage us. If you want us, we'll be there. But you encourage us by joining and getting involved in direct question, didactic sessions. This is very good. And let's do some more, and we'll wait for your feedback. Saying this, let's
continue with the cancer series, virtual and in person. Any chapter wants to do it, just reach out to us, and we'll be more than happy to continue this.
Well, I just want to quickly thank Nagesh. It was his primary initiative. This is a wonderful thing that you did, and you make the community come together, and they all feel that we are there to help. That's very important. You connect the faces, give them a face, give them a name. Thank you, Nagesh. Great job.
Thank
Great
you,
initiative.
Nagesh, for Nagesh.
And I also wish the best for the New York, New Jersey chapter tomorrow for the health and wellness initiative breast self-examination. Nagesh, best of luck. And our health and wellness team, Adnan, Sangeeta, and Tanumuri will be there.
Devasis, hand for Moon also, letting Nagesh come to help us.
Yeah. Big hand for
ठीक है ऑस्टिन मारिया सुन ठीक है ऑस्टिन बट आसनो टेक्सास टी मारिया सुन आपन माने
Jiba.
We will host you.
Thank you Julie for coming and staying there.
Thank you Debhai, thank you to you and your entire team. This was a great informative session, and I think all are benefiting, so thank you so much for your Nishkam Seva. Thank you.
Okay.
Bye. Thank you. Bye.
Thank you. Namaskar.
Namaskar.
Jai Jagannath.
Jai Jagannath.